Once again, when patients come see us for the very first time as an oncology patient, I usually like to start off by getting a history of what are the symptoms that initially led patients to seek medical attention, and then what subsequently happened, such as scans, biopsies, and what are the results of that. Obviously, if a cancer is diagnosed, a lot of times we're trying to figure out what stage is the cancer, what does this mean, what is the treatment that's going to be recommended. A lot of times the treatments may be chemotherapy, but other times it may be surgery or radiation therapy. But obviously we want to try to set up that expectations of where were we, where are we now, and what are we going to do as far as treatment moving forward. Family history is becoming very much more important these days, especially if a cancer history in the family. Cancer genetics is becoming increasingly important. So I think that's really the most important thing. We have most of the other records. Medication lists are going to be important, previous diagnoses. But yeah, that's really the most important. Usually when patients come to see us for the first appointment, I do love it when they have a family or a loved one or a friend to come with them, because I just think that 4 ears are better than 2, just to make sure they hear everything and can understand, and also kind of preparing for the appointment, making sure that they have their medical history, all their medications that are updated, as well as family history, and just kind of asking around if anybody else in their family has a history of cancer and sort of jotting that down, because cancer genetics is also becoming very important in the way we treat our patients. So whether you're coming to see me here at HOAF or one of my colleagues, what we have here is we have almost individualized teams within the greater practice. So for instance, my team, I work with 2 nurse practitioners, Kira and Linda. We also have nurses that specifically work with our team, as well as medical assistants. And so each of our physicians has their own individual team. And also being an independent practice, we have that ability to be nimble and to really cater to our patients in the way that we see fit to do so.